as I progressed through high school and college and decided to go pre-med and go to medical school, I think initially a lot of it was I found the field interesting and challenging. I think there was a lot of advancements that were going on in the field of medicine that were different than what I was used to in the basic sciences or in engineering, where I felt like I would have more direct impact on people's lives by going down the medical education route. So I think that was the initial stimulus. After getting into medical school, I think I was looking for a balance of a research oriented field and a clinically advancing field, and cardiology in my mind was one of those fields that did a very good job of integrating the latest, greatest technologies and the latest, greatest research into the therapies of patients. So as I went through medical school and became more involved in basic science research and medical research, I tended to gravitate towards cardiovascular science, and so the cumulative sum of my education and training was both as a interventional / structural heart cardiologist, but also as a cardiovascular researcher. And so I felt like it kind of helped balance everything I wanted to get out of a career, and I think it would help facilitate the things I wanted to give back to the community. Yeah, I think, Holy Cross is a very unique institution. Its relationship with Harvard Medical School and the Mass General is a large component to it being able to deliver world-class medical care in Broward. I think my initial affiliation was with Harvard and Mass General, and that's what brought me down to Holy Cross because of the relationship that they've been developing amongst the two institutions. There's also a very strong cardiovascular research center here in the Jim Moran Heart and Vascular Research Institute, which has been developing over the number of years and can certainly be a platform through which we can grow and provide more advanced therapies to a larger number of people in the Broward community. So I think there's been a number of investments and programs that have been developed, particularly in the last 2 years, in the form of the hybrid operating room, in the form of the heart failure clinic, in the form of the heart valve clinic, that directly play into the training and research that I've done over the last couple of years. And I think it's something that we can grow to help better serve the Broward community and the community in South Florida, because there's a huge need. One of the things that I've been delighted about is prior to coming to South Florida, because of my involvement in some of these clinical trials that involved therapies for octogenarians and nonagenarians, you start to understand that at the end of the day, we're all just people. And I think when we learn to deal with patients on a compassionate, human level and interact with them as if we're forming a new friendship, I think that's an important part to delivering quality health care. So I think one of the things I always try to do is come to the bedside and say, I'm going to see my friend, Mr. Davis today. And I think, that mentality helps us to elevate the level of care that we provide, because I think there's only so much we can do and God does the rest. And I think caring for our patients is really one of the biggest things we can do for them.